Okay, so when we're talking about endocrine dysfunctions, uh, there's going to be conditions where a gland is secreting inadequate amounts of hormone. Okay, and that will lead to a certain set of symptoms due to the lack of hormone produced by that particular gland. So let me give you an example. If we're talking about the adrenal gland, a lack of secretion of cortisol, we're going to call Addison's disease. If we're talking about the pancreas, a lack of insulin production, we'll call diabetes mellitus, right? So if we're talking about the thyroid gland and it's underproducing thyroid hormone, we'll call it hypothyroidism, okay? What about if there's oversecretion or hyperfunction of a particular gland? Well, we can go around and talk and give some examples again of glands that are hypersecreting hormones, and they'll have a particular name of the condition. So if it's excessive cortisol production from the adrenal gland, it'll be called Cushing's syndrome. If it's from the thyroid gland, hyperthyroidism. Okay, so it just depends on which gland is either under-secreting or over-secreting. And when we're talking about the terms primary, secondary, and tertiary, primary dysfunction means that the under-secretion or the over-secretion of hormones from a particular gland is from the gland itself, right? There's something happening with the gland that's causing less hormone to be produced or more hormone to be produced. That's a primary dysfunction. And I'll give you an example. So, for example, if the thyroid gland is being affected by a condition called Graves' disease, where there's excessive stimulation due to antibodies of the thyroid gland, well, that's a primary thyroid problem, right? It's not happening because of what's occurring in the pituitary gland or in the hypothalamus. Okay? Let's talk about a secondary dysfunction. So let's say the pituitary gland is producing excessive thyroid stimulating hormone. Okay, that's going to result in overstimulating the thyroid gland, leading to hyperthyroidism. So what's the cause of the excessive thyroid hormone in the bloodstream? Well, it's a secondary cause because the problem originated in the pituitary gland. Okay? And lastly, tertiary, which is the least important of the three, would be some kind of dysfunction of the hypothalamus that's causing the pituitary, say, to over-secrete a hormone, and then that particular hormone is going to go to a gland, such as the thyroid gland, and overstimulate the thyroid gland, okay? So think of primary and secondary as where is the problem actually occurring? If it's a pituitary overstimulation of glands around the body, well, that's a secondary problem. If it's the gland itself, such as the adrenal gland has a tumor in it and it's making too much cortisol, well, that's a primary problem. It wasn't due to an abnormal pituitary gland. Okay, so let's talk about the adrenal gland, which is situated on the superior aspect of the kidneys. And there's two parts to the adrenal gland, right? There's the adrenal cortex, where cortisol and aldosterone are produced and secreted, and the adrenal medulla, or epinephrine and norepinephrine are produced and secreted. Okay, so the sympathetic nervous system can stimulate the adrenal medulla to release norepinephrine and epinephrine into the bloodstream. ACTH can stimulate the adrenal cortex to release cortisol into the bloodstream. And how is aldosterone secreted? Well, we know aldosterone is secreted in the setting of angiotensin II production that stimulates not only vasoconstriction of the blood vessels, but also secretion of aldosterone in the adrenal cortex that then goes to the kidney and reabsorbs sodium, and by reabsorbing sodium, it reabsorbs fluid back into the bloodstream. Okay, so let's look at the sequence of events for the adrenal gland. So you have the hypothalamus at the top left, secreting corticotropin releasing hormone, CRH, that then travels a short distance to the anterior pituitary to release ACTH. ACTH travels in the bloodstream to the adrenal glands where it stimulates the adrenal cortex, and in particular, it stimulates the release of cortisol. Now remember, aldosterone is also produced in the adrenal cortex, and so are actually some androgens, which is usually considered a male hormone, and also some estrogens are produced in the adrenal cortex. Now, not to the same extent as what are produced in the ovaries or the testicles, but the adrenal cortex does have a small role in the secretion of androgens and estrogens into the bloodstream to have its effect in the body. Okay. Adrenal medulla is where typically you'll have your catecholamines released, in particular epinephrine, which is the same term as adrenaline, and norepinephrine, which is the same term as noradrenaline. Okay, so that's the overall sequence of events for the adrenal cortex and the adrenal medulla. Remember, cortisol feeds back to the pituitary and the hypothalamus to reduce production of CRH and ACTH so that it's always maintained at a proper level to maintain homeostasis. Okay, so I just reviewed this on the slide above, how ACTH from the pituitary gland stimulates the adrenal cortex. What adrenal hormones are in the adrenal cortex? Glucocorticoids, so that's cortisol. Mineralocorticoids, that's aldosterone. And we call it mineralocorticoid because it's reabsorbing a mineral. It's reabsorbing sodium. And by the way, it's also excreting potassium into the renal tubules, right? And then lastly, you have small amounts of androgens and estrogens produced in the adrenal cortex. Okay, the adrenal medulla, well, that's stimulated by the sympathetic nervous system to put epinephrine, norepinephrine, and also some dopamine into the bloodstream when it's activated by the sympathetic nervous system. Okay, so let's look at a condition called Cushing's disease or Cushing's syndrome. There's a slight difference there. They'll result in the same symptoms, but let's just look at the very small difference between the two. So Cushing's syndrome is basically anything that causes increased corticosteroids in the body. And so what's the most common cause of Cushing's syndrome? Well, that's typically cortisol, such as prednisone or dexamethasone, that we give patients that can lead to Cushing's syndrome. Or it could be a tumor in the adrenal gland that's producing excessive um, cortisol that's going into the bloodstream. So that's Cushing's syndrome. Now, Cushing's disease, it's still going to cause release of cortisol from the adrenal gland, but Cushing's disease is reserved for a term where you have a tumor in the pituitary gland that's releasing excessive ACTH, leading to excessive cortisol secretion by the adrenal gland. Okay, so I mean, in the end, it comes to the same result. You have too much cortisol in your bloodstream. Okay, but where's the cortisol coming from? Well, in Cushing's syndrome, it's coming either by a prescription, and now you're taking prednisone or dexamethasone continually for weeks and weeks and weeks, and it'll lead to Cushing's syndrome, or you have a tumor in your adrenal gland that's overproducing cortisol in the bloodstream, versus Cushing's disease, which is a tumor of the pituitary gland. We would call it a pituitary adenoma that's releasing too much ACTH. Okay, so let's look at cortisol, which is a steroid type hormone. Okay, it has a steroid ring, and we consider cortisol a stress hormone. So it would be elevated if you're under stress, right? Whether it's a physical stress or a physical illness or even a psychological stress can increase circulating cortisol levels in the bloodstream. Okay, so what does cortisol do in the bloodstream? So it acts on adipose tissue, so fat cells, and it can store fat. And that's why we're going to see that you're going to have, develop obesity in certain areas and weight gain from fat, right? So it can store it in your face. It can store it in the back of your neck. Truncal obesity or truncal fat is basically abdominal fat. So think of Cushing's or cortisol as a hormone that can affect fat cells in order to increase fat storage. Okay, and of course in the process, gaining weight. Okay, it's going to stimulate the liver to break down glycogen into glucose. Well, why would it do that? Well, it does that because it's a stress hormone. So it's increased under times of duress or stress. Okay, so the body is preparing for something. Some kind of stress is coming. So it wants to have higher levels of glucose in the bloodstream. And in fact, if you have excessive cortisol in your bloodstream, that can lead to type 2 diabetes because it's constantly releasing glucose from the liver. And you end up with elevated glucose levels in the bloodstream, type 2 diabetes. Okay, so when we give patients prednisone or decadron, we will see a lot of these effects happening, right? Especially if they're on prednisone or decadron for a long time. They're going to develop truncal obesity. They're going to develop this moon face. They're going to have a hump at the back of the neck, which is storage of adipose tissue. They're definitely going to gain weight because not only of storage of fat, but also cortisol stimulates appetite. Okay, they can develop type 2 diabetes because of all the elevation in the circulating glucose. Protein breakdown. Well, cortisol stimulates protein breakdown, not only to use as energy, but it can convert it to storage of fat. Okay? So protein breakdown is never a good thing because that can lead to wasting of muscles, so thinning of your muscles. And that's why patients that are on cortisols, such again, prednisone, dexamethasone, hydrocortisone, there's many of them. They all have the same effects. They can get muscle wasting, which can make it difficult for them to walk, right? And that's all due to the cortisol levels in the bloodstream. Cortisol has thinning effects on collagen. So loss of collagen leads to thin skin, bruising of the skin, weaker ligaments that are holding your joints together. Okay, increased ability to bruise is very common when you're on cortisol, or you have some kind of a condition such as Cushing's disease or Cushing's syndrome, where there's just an excessive cortisol level in the bloodstream. It can also alter your mood. So excessive cortisol levels have an effect on your brain, and often patients have mood changes, such as depression. They often have insomnia. Okay, they can't fall asleep at night because of excessive cortisol. Okay, cortisol also leads to bone breakdown, and bone breakdown is going to cause osteoporosis and increased risk of fractures later in life. Okay, cortisol leads to hypertension. Okay, because there's also aldosterone being secreted by the adrenal cortex, and that can lead to reabsorption of sodium, reabsorption of fluid. But cortisol itself, being a stress hormone, also causes hypertension. Androgens are released by the adrenal cortex. Okay, and if you have excessive androgens released in response, say, to too much ACTH, or if you have an adrenal tumor, well, androgens are the male hormone. They can lead to acne. Okay, estrogen is also produced in the adrenal gland. So if it's excessively produced, it can lead to feminization. Okay. Cortisol inhibits the immune system. It inhibits the inflammatory system. So you're more at risk of recurrent infections if you're, say, for example, taking a cortisone or a cortisol long term for a certain condition that you need to take it for. Okay, so let's just go around this image and talk about the effects of excessive cortisol in the bloodstream. Okay, this is really important because we use a lot of corticosteroids in treatments, so as medications, right? So we see a lot of these side effects to excessive cortisol. Okay, so what's the most common way that someone's going to have Cushing's syndrome? Well, it's administration of a corticosteroid to a patient. That's by far the most common way that someone's going to have Cushing's syndrome. It's from the medical community having to give them prednisone or dexamethasone, say for recurrent asthma flare-ups, or for their rheumatoid arthritis, or for their lupus, or to settle down a flare-up of their Crohn's disease or ulcerative colitis. So we use a lot of cortisols to treat many conditions, and then as a side effect, we give Cushing's syndrome. Okay, so let's look at these quickly on the image. So hyperglycemia, yes, it causes release of glucose from the liver, where it's stored as glycogen, but then it's released into the bloodstream as sugar, causing hyperglycemia and potentially type 2 diabetes. CNS irritability, yes, cortisol affects the brain and can lead to anxiety. It can also lead to personality changes and also depression. It retains sodium and fluid from the kidneys, so you can get peripheral edema. You can get increased circulating plasma volume, which will cause hypertension from the sodium and fluid retention from the cortisol, but also potentially if there's any aldosterone secreted as well. Okay. Thin extremities. Well, that's the muscle wasting that can happen with continued excessive cortisol in the bloodstream. So patients often will have thin legs and thin arms if they're on long-term cortisol. Gastrointestinal distress. So cortisol affects the stomach. It increases acidity. It can lead to peptic ulcer disease and gastrointestinal bleeding. Okay. In females, so amenorrhea is loss of periods. Okay. Why does that happen? Well, if you have excessive estrogen being released by the adrenal cortex, that's going to turn off FSH and LH from the pituitary gland, and that will lead to no periods. Okay. Hirsutism, that is where certain tissues respond to androgens released by the adrenal cortex, such as some facial hair, maybe some gynecomastia in males, right? So that's hirsutism. Thin skin, yep, collagen is reduced. That leads to thin skin, bruising of the skin, easily injured skin. Okay. Purple stria are areas where the blood vessels are showing through, and actually where some of the blood vessels have broken under the skin. Okay. Bruises and petechiae of the skin, very common while on cortisol for a long time. Osteoporosis. Cortisol causes loss of calcium from the bones, leading to very thin, fragile bones. So that's a big risk with long-term use of corticosteroids. There's fat deposits on the face, leading to a moon face. On the back of your lower neck, called a buffalo hump. Okay, those are fat deposits. I mentioned gynecomastia because of the estrogens that are released by the adrenal cortex. Increased risk of infections because cortisol suppresses the immune system. So if anyone's ever on long-term prednisone or dexamethasone, they are definitely at risk for acquiring infection because we've suppressed their immune system. Okay. The moon phase I mentioned, and of course personality changes would go along also with CNS irritability, right? So depression, anxiety. Some people can actually get psychotic on cortisol. Okay, they can have a steroid psychosis, it's called. Okay, so when we look at the left here, yes, there can be excessive cortisol secretion from the adrenal gland, and we'd call that Cushing's syndrome. There can also be, in that setting, if there's a tumor of the adrenal gland, excessive secretion of aldosterone along with the cortisol. But by far the most common cause is the prescriptions that patients are having to take for glucocorticoids to treat other diseases that leads to Cushing's syndrome. Okay. the pituitary tumor that's releasing ACTH, we reserve the term Cushing's disease for. That's a relatively minor difference. It still leads to the same result, excessive cortisol in the bloodstream. So let's just look at some images here of some excessive cortisol effects. So the moon face, the buffalo hump, the abdominal striae that occur with too much circulating cortisol. And what's the main cause of excessive cortisol in a patient? It's continued administration of cortisol to treat another illness. Okay, and then of course you get, as a side effect, Cushing's syndrome. So what are the less common conditions that cause Cushing's syndrome? Well, an adrenal tumor that's secreting excessive cortisol into the bloodstream, or a pituitary tumor that's producing too much ACTH can lead to Cushing's disease. So I would say it's really important to spend some time and know the adverse effects, so the side effects of too much circulating cortisol, because you're going to see these effects since so many patients are having to take corticosteroids for other conditions, right? So they get Cushing's syndrome as a side effect for ongoing use of prednisone or dexamethasone or any other cortisol. So once you know the adverse effects of one cortisol, you'll know the adverse effects of any different type of prescription cortisol. Okay, so really pushing home this point because of how important this particular condition is, because we give patients steroids all the time. Okay, so it's not for you to go away and think, oh, so pituitary adenomas that secrete ACTH are extremely common. No, not really. Adrenal tumors that produce too much cortisol are very, very common. No, not really. By far the most common way to develop Cushing's syndrome is through a prescription for ongoing corticosteroids. Okay, I won't go through all the effects on the right there because we've done them, but just know all of these effects. They're really important. People get these when they've been on cortisols for months. Okay, so this doesn't happen if you're on prednisone, say for 5 days or a week because you have an asthma flare, or you had to take prednisone because you fell in some poison ivy and you're covered in a terribly itchy rash and you need prednisone for a week or two. No, this is ongoing administration of corticosteroids.